Hello, my name's Chris Price, and I did my research on the treatment of ADHD without medication. Um, there were several reasons I chose this topic. Uh, this topic of ADHD and its possible treatments have been a topic that's interested me for a while. I have several opinions on the treatment process. I think there's many parents, not all of course, but many, jump straight to medicine almost as a way to avoid having to parent and avoid discipline for their child, and they use this as a form instead, and I don't really agree with that. I wanted to see if there are healthier ways to treat this disorder, and just really see if there's a way we can avoid the medication, and I also want to see if it can be more productive than it would be treating it with medication. And I also feel like I meet most of the criteria for this disorder, and I want to see what I should do. There were two different meta-analyses that I found that really related to everything that I was looking for. I was looking for a way to treat school-age children for this without using medication. The first one was it was a meta-analysis that researched 60 different studies on school-based interventions, and it found that school-based treatment without medication, where you basically use cognitive behavioral therapy, was very effective, and suggested that this form of treatment be started at a younger age. That was the main findings of it. It studied that over, like I said, 60 different studies, and it found it to be very effective all over. Then there was also the another meta-analysis on the efficacy and safety of a certain drug that I'm not really sure how to say. I can try it. Atomoxetine. I'm not really sure if that's the best way, but it really just took one of the more successful drugs that treat ADHD and found the effectiveness of it, but then also looked at the side effects, and it found it to be very effective. So that was a positive. But then there were also several side effects, such as lack of sleep and stomach disorders and stuff that came from that. So that was reasons why it should be avoided. There were two different evidence-based practice programs that I found. First one was called the Challenging Horizons program, and in this one there were two different ways that you could implement this treatment. There were where you can pull the student out and have one-on-one sessions with them, with, for example, a teacher or a counselor or somebody, about once or twice a week, and really be a mentor for that person. Or then there was the way where you could have an after-school program and meet with them 2 or 3 times a week after school with them and several other people that have those. I thought that this one would work well at Adonta, but we're going to get more into that here in just a second when I go over the pros and cons. The other plan was the Children's Summer Treatment Program, and this one is ran more like a summer camp. You go 5 days a week. It's almost set up like continue going to school throughout the summer. It's set up for an 8-week plan, and it's for students grade 1 to 6, and they go for 6 to 9 hours a day, 5 days a week. And then we'll talk about that more here in just a second. There's parts of each one that I would like to implement if I could do this at Adonta, part of the plan. As far as the Challenging Horizons program, some of the advantages was meeting in the school. It offers the students a chance to stay in their comfort zone and still be treated. It's a teaching aspect instead of medication or discipline, and that's always a positive whenever you can talk to these children before whatever they're doing becomes an issue. And meeting one-on-one would be implemented, and I think that's always a positive when a student can really just get to talk to somebody that's in authority and just get to know them. As far as the Children's Summer Program, there was part of this where they had daily report cards. I think this is really reward focused. Whenever they did a good job, they could know that by their report cards, and they could see improvement, see decline. That was very big. Positive reinforcement, like I said with that. The design of the program's nice. A big advantage was that you continue to treat it, because if you were to implement something like the Challenging Horizons program, during summer break, the children would lose basically everything that they learned throughout that process and have to start back from square one the next year. And the timetable would be similar to like a school day or a work day for people who are getting older, even though the program's just for grades 1 to 6. So there were some things I didn't like about the studies. The Challenging Horizons program didn't offer a form of feedback like the summer program did, so if you could combine the two, that would be pretty nice to keep that going. And an after-school program could lead to tired children who are less likely to pay attention, and with children who have ADHD, that could be an issue as it is. Then in the other one, medication was not removed from the treatment plan in the summer treatment program, and that was really what I was looking at. So the studies that showed that there were positive results didn't really help mine, but my theory of trying to eliminate medication, but I feel like a lot of the interventions would have worked because they were somewhat similar to the other one. And long amount of times meeting, I don't know if it would be good for children with ADHD for the same reason as the other one. They'll be less likely to pay attention the longer that you go. But those are some things that can be worked around and find alternatives to those. That's all I have, and thank you so much. Have a good day. Bye.